Welcome back. Thank you for staying with us. This is Gusile Breakfast Show. On the 1st of March this year, the clinic group will host its annual health symposium. We're now joined by Dr. Shelton Avambe from the Mbabane Clinic to tell us more about it. A very good morning, Doctor. Thank you for joining us. Tell us all about the symposium, what it is and what it inspired this initiative.
Good morning. Thanks to you. Good morning to our viewers. The Health Symposium is a time where we have a platform for healthcare practitioners to come around and collaborate and share insights on latest in the field of health. So we were inspired by our commitment to make sure our clients receive the best. So by collaborating with other practitioners, we come up with ideas and strategies that help to improve our patient care.
Okay. Speaking of patient care, what are some of the key health issues that you'll be discussing at the health symposium? What is the theme this year?
All right. Our theme is going to be envisioning healthcare 2030, AI's role in the future of medicine. We are going to be looking at the impact that artificial intelligence is bringing to the field of medicine. So we'll delve into the several aspects that span from how AI is utilized from diagnosing patients, in terms of treatments, in terms of pharmacy. It's going to be an exciting discussion with a lot of topics around the artificial intelligence in medicine.
Yeah, for the clinic group to have this symposium, there had to be gaps that were noted in the healthcare, particularly at the clinic group. What are some of these gaps that you noted as health practitioners?
All right. As we strive to give our patients the best care, we want to move with the technology. The gaps that we identified is that globally, as we move towards first world status, things are changing and technology is here. It's a matter of us also adopting so that our patients receive the best care. So the gaps in terms of efficiency that will be addressed by artificial intelligence, those are some of the things that made us look into what AI can do for us as the clinic group.
Okay, so how do you rate the best healthcare as health practitioners? How do you know that, no, I give myself 100% to this patient?
All right. For us to rate, it's actually our clients who give us the feedback. That's how we know that we are the best, because we look and listen to our clients. We are always patient-centered. So we want to make sure our clients come up the first. So we are the first because of the feedback that we receive from our clients, that we have been doing well, and we move on.
Okay. So how does this symposium align with the clinic group's mission, your health is our priority?
All right. With the symposium, since it's going to address different aspects that will in turn improve our patients, we are going to be prioritizing our patients, because we are going to come up with plans and ideas that will make sure the patient receive the best care, the patient receive the latest care. And I will give an example. We are coming up with ideas that will make sure clients, instead of staying longer in the hospital, because of the advancement in this artificial intelligence, their days will be minimum. And also, for another example, will be instead of going through a surgery that is very long, or even opening the patient, then we are just going to put small holes. That means your recovery time is going to be quicker. So those are some of the things that makes us want to improve and prioritize our patients.
Yeah, all right. So how much impact will this symposium have on your attendees? You did say that health practitioners from countrywide will attend the symposium. Others come from communities that are in the rural areas. What impact will this symposium have on them?
We hope that the attendees, which will include, as you rightfully mentioned, other practitioners and also other stakeholders from the government, policymakers, we hope that the impact will be stimulation of this idea of bringing artificial intelligence. Okay. As we stimulate, it's an ongoing discussion, and we hope that with the policymakers being involved and other practitioners being involved, we'll start to set up ourselves to prepare, so that when it's finally here, everyone can embrace. We know about the advantages, we know about the disadvantages. So we expect the impact to go far and wide so that all the people can know about artificial intelligence in medicine.
Okay, so what activities, discussions, or workshops can the attendees expect? Any notable speakers, experts, or panelists that will attend the symposium?
Rightfully, we do have several keynote speakers, some regionally, some even from abroad, some who are directly dealing with artificial intelligence at the moment that will be assisting us with sharing their latest. So we have several panel discussions, we have question and answer sessions. We're also going to have a few activities that are practical where we'll take our phones and try to practicalize this artificial intelligence just to try and see the impact and what we are talking about.
All right, so how do organizations or attendees register for the symposium?
It's quite easy. We have a registration link that is shared in our platforms, in the social media. So if you log on, you'll be able to check on the link and you click the easy steps. And if you are having challenges, you can also reach at our email. They will be able to assist us with registration.
Yeah. So one of the key messages is delivering positive patient outcomes. How does the symposium contribute to that goal?
So we want the symposium to expose or to bring about different ways that artificial intelligence is able to assist in terms of medical treatments, in terms of diagnosing, in terms of radiological investigations. I'll give you an example. We will be exploring how the use of intelligence in diagnosing common things like your tuberculosis is aided with the use of artificial intelligence, and that way, indirectly, our patients will get the best, and we are going to make sure that they receive the best treatment possible.
Okay, so how does the clinic group ensure that expert healthcare and excellent customer service remain at the forefront of its operations?
That's a good question. I think our main focus is being customer-centric. We listen to our customers and we try and address, it could be issues that they bring about. Yeah. That way we continuously improve and we get better and improve our customer service and retention.
Okay, so I remember that last year you did host the symposium, and I assume that there were issues or suggestions or even solutions that were raised. What were some of those discussions that were discussed last year? And for the issues that were raised, has the clinic group found solutions to those issues?
All right. Last year's theme was bringing about a collaboration between private and public sectors together so that we can move and forge ahead as a collective. So we are addressing some of the issues that deal with collaborating between the private sector and the public sector. We are looking at ways that our patients can receive care from both places in a convenient way, and our referral systems we are polishing up, and we are addressing those key issues that were raised last year.
Yeah, speaking of patient care, is there a window, a platform, or a platform that your patients can use to lodge their suggestions regarding the hospital or the clinic?
All right. We have quite several ways that we can give our clients. We have suggestion boxes. We have a platform on WhatsApp. After receiving treatment, you scan a code at the reception and you go through a set of questions. It's a simple task where you select your answers and feedback. We also have small feedback forms, whether you are admitted or you just come in as a work patient, that you write and give your feedback before you leave the clinic. So we actually have quite several ways of getting feedback from our clients.
Okay, so how many people are you anticipating to attend the symposium? Is there a limit? Is registration at a fee? So what are the more critical details that attendees should know?
We're expecting to have a lot of attendees because this is a free service. We think it should be accessible to everyone. I can't give you a number, but we're expecting as many people as possible to register. You could be a medical student who is still qualifying and you are interested. Anyone who is interested in the health and technology sector can actually come from suppliers of medical equipment. We have several people who are going to be attending. It's going to be an exciting initiative.
Okay, so how do they register? What are the contact details and when is the deadline to register?
The contact details, we have a platform that I mentioned on our social media that they are going to be using as a registration. And our email info@clinicgroup.co.sz is where they can get extra information on how to register, both as a corporate or as an individual who is going to be attending.
Okay.
Those are the ways that we are having for registration.
Okay, so lastly, where is the symposium going to be held?
This year's symposium will be held at Happy Valley on the 1st of March, which will be a Saturday. We'll start around 8 o'clock in the morning. We should be concluding our business around 4:30.
Or it's just one day?
Yes, this
It's a
time it's going
one-day
to be one
symposium.
day.
Okay.
We are also cognizant people are busy, so that's why we did it on a weekend, so that people have enough time and they can attend and go back to continue with their activities for the weekend.
All right, thank you, Doctor. That is Dr. Shelton from the Clinic Group telling us more about this year's health symposium hosted by the Clinic Group. It will be held on the 1st of March at the Happy Valley Hotel at Eswatini. For more details such as registrations, information, do